Okay, so we're going to be doing a clean dressing change. Gathering equipment, since you can't see it, we have our gauze, solution, tape, Sharpie, gloves. Okay, first things first, gather that, wash your hands. I'm going to introduce ourselves. So, hi, my name is Michaela. I'm going to be your student nurse today. Could you please verify your name and your date of birth for me? Okay, awesome. So the purpose of this procedure is we're going to be changing your wound dressing today, making sure it stays nice and clean. So safety survey, making sure the bed is in the lowest and locked position. They have their grippy socks or shoes on. Their bed alarm is set appropriately, and their call light is within reach. So before we do this, we're going to check the provider order, make sure that we're doing the correct thing. We are. Okay, so again, we'll be able to teach the patient about the procedure here. So again, the purpose of this is to make sure that the wound stays as clean as possible with limited exposure, and making sure that it stays clean and dry without any leakage causing more infection. So asking the patient if they have any questions or concerns. And then we would go right into our pain assessment. So rating their pain on a scale of 0 being no pain at all and 10 being the worst pain they've ever experienced. And then from there, based on their number, we would put them in a comfortable position before starting with the procedure. So we're going to wash our hands again. We're going to apply our gloves here. Okay. Okay, now we're going to take a look here. And we're going to remove the tape using the push-pull method. So we have the dressing off here. So now we are going to inspect the dressing, look if there's any drainage, any color, odor, anything out of the ordinary, what kind of drainage we have here. And then after inspecting, we're going to discard this. And then now we're going to look at the wound, assess the wound, how does it look? Is there any color on the skin that doesn't look good? Is there any irritation? Is the wound draining really badly? Anything like that? And then we would verbalize signs and symptoms of the infection versus healing to see how the wound is doing. So then we would measure the size and the depth of the wound. So we would measure the length, the width, as well as the depth of the wound in centimeters. Okay, and after we've done that, these are now dirty, so we're going to remove the gloves. Get rid of these here, put them away. Okay, and we're going to wash our hands again. Perfect. Alright. So now we're going to prepare our supplies after throwing the gloves away. Get new ones ready. So now we're going to take the gauze here, open this up. I'm going to throw these on here. Okay. Okay. the saline here for this new gauze. Alright. So we're going to now pull at each corner of the gauze here in order to get it fully equipped here. Okay. And we're going to use the center of this to clean out the wound. So starting from the clean into the wound. Slowly making sure you're getting all the way in there. Center towards the edges. Okay, and then around here. Perfect. Okay. So now if there were meds ordered, we would then use our 3 checks and verbalize the patient's 11 rights. And then from there, we're removing these gloves, since they're now dirty. Away. And then again, wash our hands. And again, we're going to apply clean gloves. There we go. So now, this is the right one, right? Okay. Open up the pad here. Okay. So now, since this is dry here, so now we're going to apply the layers of dry dressing onto the wound here, making sure it's nice and secure. And then we would verbalize use of 2+ if the drainage is expected from the wound. And then we would now secure the dressing with our tape here. Okay. On all edges like a window pane. So what we're going to do is we'll start up top here. Make sure it's laying flat. And then rip. And then on this side. Okay. Right here on this side. And then one more. Perfect. Making sure this dressing stays secure. Okay, and we're going to remove the gloves of this card down. Wash our hands one more time. Okay. then we would provide our initials, date and time that this wound was changed. So, 12:50, 10:08. Alright, so I'm going to clean up the supplies here, make sure everything is cleaned off. And then from here we would assess the patient, ask how they're doing since the wound dressing had been changed, cover that up here, make sure they're good to go. And then after that we would then document that we had changed the wound, again writing down the date and the time that it had been done and who was the person that did it.